This is Dr. Lucy Rathier, psychologist with the Villages Health. Today, I wanted to offer some tips on communicating with healthcare providers. Interactions with healthcare providers can often be confusing and frustrating. For example, if we say to our healthcare provider, "My pain seems worse," the provider might respond, "Well, my examination doesn't show anything new. How might you feel?" You might feel frustrated. You might feel like disappointed. You might feel discouraged. We certainly don't want that. But here's the thing, your healthcare provider doesn't always know what you want. Let's think about that. Let's use another example. Think about if someone said, "I have a good sense of humor." What could that person mean by that statement? They could mean that they see the funny sides of things often. They could mean that they like to play practical jokes. They could mean that they like to laugh at themselves, or that they're quick-witted. The point is that a statement can have many different meanings, and we don't know for sure exactly what the person meant until he or she adds more information to clarify it. In that same vein, your healthcare provider doesn't always know what you want. You need to clarify and be more explicit. In most interactions with our healthcare providers, we would like to receive the following. We'd like to get some information. Maybe we want further analysis or evaluation of the presenting concern. Maybe we want some advice on what we need to do to manage it or what kind of treatments would be appropriate. Maybe we want some understanding of our frustration in the care of that particular medical condition. Or maybe we want some reassurance to have them instill a sense of hope that it's going to get better. So think about it. If we went to the healthcare provider and said, "My pain seemed worse," but then added, "I would like you to further evaluate this and if necessary, run appropriate tests to see if it's just something minor or something new," or ask, "Should I change anything in how my condition is being treated?" Or let them know, "I'm scared because the pain seems different. I'd appreciate it if you would do this to reassure me." What are we seeking? Well, we're certainly seeking further analysis. We're certainly seeking advice on whether or not it's being treated in the best manner. Is there other options available? And we're certainly seeking reassurance that it's not something major, that we want to know it's something manageable or not something to be overly worried about. So when we would like these things, here's how we could phrase it. We want more information, we could say, "I'd like to know what other types of treatment I should consider and what they could do for me." Looking at the pros and cons of the various treatment options. You want more analysis, "I'd like further evaluation to determine if there's another cause to my condition. Should labs be run? Should there be imaging studies? Should you be referred to a specialist? Are there other things that the doctor could investigate?" Maybe you like some advice. Maybe you saw some other treatment options that were non-pharmacological, like physical therapy or acupuncture, um, or behavioral treatment of chronic pain. So maybe you want another opinion on whether those treatments might be viable for you. Again, maybe you want some understanding and you say, "It's very frustrating to go through trial of medications," which is true. It is. Sometimes medications don't work. We all have individual chemistries, and some medications work better for some people than others. And we don't know that until we try using the medication, and that can be really frustrating. So you want the healthcare provider to understand that. Or again, maybe you'd like reassurance. "I'd like reassurance there's an effective treatment for me." We all want to have a sense of hope that things are going to get better. It's really important before you have a medical encounter to think about specifically what you want to get out of that encounter. So, in advance of going to your appointment, think about what specific questions or concerns are most important for you to address. Even though the Village's Health is very generous with the time you spend with your medical providers, and you get a half hour for a more urgent visit and an hour at your annual, you may only have time to address a few concerns. So be sure that you prioritize them before you visit or call your provider. Make sure you have identified the symptoms that you're experiencing and your thoughts about what possible triggers could happen. So, for example, if you've had an exacerbation of pain, did you overexert yourself? And that's what did it. If you had some digestive system problems, think back on what kinds of things you ate recently. And, would that have done it? Or have you been on a new medication that was prescribed by this healthcare provider or another? And might that have led to particular side effects? So, write that out, list all the remedies, the non-medical, like I iced it or I put heat on it or I rested, list all the medications you've tried, write them down. Write down all your questions, concerns, symptoms, triggers, remedies, medications that you've tried. It's very easy to go down one path in a medical encounter and you forget then to talk about some other concerns you had. So if you have it written down in like a piece of paper or steno book, or you even put it in the notes app on your smartphone and call it up, that can help you retain focus during your medical visit. And think again about what you're seeking. So again, just like those 5 or 6 potential things that you're looking for, do you want more evaluation or analysis? Do you want some advice on possible treatments? Do you want understanding? Do you want reassurance? And just like we wrote down on that previous slide of how you can ask for that, write that down as well. Decide in advance if you want to bring another person, like a caregiver, spouse, partner with you to your appointment. That may be useful if you have extensive care needs, are used to someone else managing your care, or just that you don't want to forget something that was said. We want to collaborate with you. That produces the best outcomes from a medical visit. So it's incumbent upon you to be an active and informed participant in your medical visit. So at the onset of your medical visit, let your healthcare provider know you've got a plan, you've got some things that you want to address. And specifically tell him or her what that list is that you've just written down. Say, I want to go over my pain, I want to go over treatment ideas. Be very specific and very clear. Again, saying I want some reassurance, I want some treatment advice, I'm wondering if I need further analysis. That being said, your healthcare provider might want to check on some chronic conditions that you have to make sure that they're managed properly, like if you have diabetes or hypertension or high cholesterol. So they might want to review some of those findings from lab results, or just to make sure that you're on track in managing those conditions. So you need to also listen to your healthcare provider and agree together on what you're going to cover during that medical visit. Remembering that, again, even though you have a lot of time in a medical encounter, it is limited. And if you have multiple health concerns, if you have 20 different medical conditions, you may not be able to address them all, even in an hour appointment. You may need to schedule more than one visit. Recognize that not all questions have answers, especially those beginning with why. Sometimes we don't know the cause of a particular medical condition. We might know that we have it, and the cause of it may not be entirely clear. The provider is going to do the best that he or she can to determine that, but it's not, we don't always know why somebody got cancer, for example. Um, we have to sometimes tolerate the ambiguity of that. During the medical appointment, it is absolutely necessary that you are totally open and honest with your healthcare provider, and giving all information and answering all questions, even if they make you feel uncomfortable. Your provider needs complete information to provide the proper care. So remember, everything is confidential. What you say to your healthcare provider does not get shared with anyone else outside of the healthcare entity, unless you give written permission, or of course, if there is a threat to the safety of yourself or anyone else. So meaning if someone is suicidal or homicidal, then confidentiality is broken. Otherwise, it remains intact. Be sure you understand the diagnosis given. Medical terminology is very complex, and so we don't always know what it means. And make sure you ask, discuss with your healthcare provider the different ways of handling your health problems. There might be, again, medical and non-medical treatments that are appropriate, or different test options. So be sure that you understand the pros and cons of each option so that you can discuss with your healthcare provider kind of what's important to you and what's not so important. Find out what would happen if you didn't treat the condition. So in some cases, there are conditions that don't warrant treatment. So for example, if it's a very benign, um, not aggressive form of prostate cancer, often there's what's called watchful waiting, that it takes so long for a non-aggressive form of prostate cancer to spread that likely it is not going to be the cause of death or any harm, that somebody might die from something else years before the prostate cancer would ever hurt them. So in some cases, if nothing's done, that's watchful waiting, and that's the appropriate course of action. And in other cases, it might be dangerous if nothing is done. So you need to know that. And again, if you're interested in some non-traditional or non-pharmacological approaches, whether dietary changes would help, engaging in exercise, alternative treatments like acupuncture or physical therapy or psychotherapy, you might want to ask about those as well. And where you can find additional reliable information on your medical condition. So lots of stuff gets put on the internet. Not all of it is reliable or accurate. You want to go to a reputable site, and your healthcare provider can help guide you to those. But typically those are sites that are from reputable professional organizations like the American Diabetes Association, or from reputable hospitals like WebMD, I believe is put on by either the Cleveland Clinic or Harvard Medical. There's only the Mayo Clinic site, which is more reputable. So you want to ask where you can find additional information. And make sure you understand the treatment recommendations. So again, do not be reluctant to ask questions if you don't understand something that's said. It's often helpful to take notes during your visit. It might be helpful for you to repeat back to your healthcare provider what was said, to make sure you have understood what the diagnosis is, what the treatment recommendations are, what you're specifically supposed to do so that your notes are accurate. If you need some help with certain terminology, you can certainly ask your healthcare provider to write that down. Usually at the Villages Health, you're given a visit summary in your patient portal. So that's always a good place to look at what the doctor has written in your summary, so that you can remember what you're supposed to do and what medications you might need to try. And follow up. So, if the doctor or other healthcare provider recommends something, follow through with them. If there's some barrier to your being able to follow through with these treatment recommendations, let your healthcare provider know. We There might be a workaround, there might be an alternative treatment. Certainly if the cost of the treatment is prohibitive, there might be ways to find a less costly treatment or to get some financial assistance with the treatment via pharmaceutical companies, for example. So you need to communicate via phone or the patient portal. Um, if blood work or other tests were conducted either during or shortly after your medical visit, again, you can either check back with your provider's office or use the patient portal. Those are very effective ways to get that information. And again, so try them. And again, if you're trying them and it's not working, let your healthcare provider know as soon as possible. Um, be sure to talk to the healthcare provider and not stop a treatment abruptly. Some medications, for example, you can get very adverse side effects if you stop them abruptly, like for example, antidepressants or anxiety medications. If you stop it abruptly, you can get a really bad rebound effect. So make sure that you inform your healthcare provider and they can give you a taper schedule. You should never stop a medication without talking to your healthcare provider first. Conversely, recognize that some treatments take a while to be effective. So for example, most antidepressants can take up to 6 weeks to reach a therapeutic level. And I understand that's a long time and it feels very frustrating, but it's not going to work in a matter of days. And so you have to be patient with it and give it chance to work. Um, and then, work together with your healthcare provider to determine next steps to take if some treatments are not working. And remember, open communication is an important part of your overall care. If you're not currently on the patient portal in the Village's Health, this link will take you to a tutorial that will help you to set it up. It, uh, it's a very effective way of communicating with your provider and getting your healthcare information. You can see your lab results, you can see upcoming appointments, you can see summaries of visits, and you can also communicate with your healthcare team in a very effective and efficient manner. So I highly recommend you use this if you're not already. So again, at the Village's Health, we want you to stay healthy and heal quickly and encourage you to call or use the patient portal with any concerns or questions that you have. And I hope that this information is helpful to you in having a very effective medical visit. Thank you for your time.